Today let us learn about hormonal contraceptives. What is a contraceptive? Contraceptive is the one which prevents the conception. What is conception? It is the fertilization. What is hormonal term? We use hormonal tablets or injectable forms or implants or transdermal patches um, in order to prevent conception. This is called hormonal contraception. And in hormonal contraceptives, we mainly use oral ones. Today, let us discuss about mainly oral one. The oral pills are divided into four types. They are combined pill, phased pill, progestin only pill, emergency pill. In combined pill, we take the combinations of estrogen and progestins in a fixed dose. The estrogen uh, the estrogen examples are ethinyl estradiol, and progestin examples are norgestrol, levonorgestrol, desogestrol, norgestimate. And here in combined pill, there are three generations. In first generation, some pills are included, and after first generation, the second generation is identified so as to decrease the dose of estrogen and progestins with the same efficacy but less side effects. And after second generation, the third generation are also identified by improved research. And this combined pill, how it do action? It inhibit ovulation. This estrogen component and progestin component both synergize the action and inhibit the ovulation. And this progestin, it have other actions also, like ensure prompt bleeding and decrease risk of endometrial carcinoma. This endometrial carcinoma will occur due to increase in the estrogen content. So when we combine these both the drugs, the progestin will decrease the adverse effect of estrogen, like decreasing the risk of endometrial carcinoma. These two are progestin's action, and they both combinedly inhibit the ovulation. Okay, what is the usage of combined pill? How we use the combined pill in our daily process? um, we should start at the fifth day of the menstruation and continue the use for 21 days, and after which the bleeding occurs, so we should stop the 7 days usage we should stop, and again at the fifth day of menstruation we should restart up to till we don't want any conception. This is the most popular type of pill, combined pill is, and it is the most efficacious one. The phased pill, next one is the phased pill. In phased pill, there are three phases: monophasic, biphasic, and also triphasic ones. In monophasic pills, taking the same drug throughout the course. Mono means only one, phasic means throughout the entire course we only use that same drug. What is that same drug? We maximum take estrogen and progesterone combined pills. The usage is same as combined pills. Start at 5th day, 21 days usage, and after a gap of 7 days bleeding occurs. This in 7 days this bleeding occurs, so when the bleeding occurs we should not take. In biphasic ones, it decrease the hormone amount. Why these biphasic ones are created when monophasic ones are better in their action? Why is biphasic ones are created? So as to decrease the amount of hormones consists of estrogen and progestin. In biphasic ones we take first 10 days we take estrogen component, and the next 11 days we take progestin components, and in bleeding period we should not take any tablet. It has risk of endometrial cancer, so not preferred. When we take estrogen single handedly, it will cause endometrial cancer or carcinoma. so we should not take like that. So it is not preferred. In triphasic ones, it is usually taken by more than 35 years old women. Low dose estrogen and progestin is used in triphasic pills, and low side effects are there. If a woman skipped a pill, usually skips the pill one day or other day, we normally forget that. So if a woman skipped a pill, she should take 2 pills next day. If a woman skipped 2 pills at a time, uh, course should be withdrawn and follow alternative for this cycle and restart on 5th day of cycle. Have you understood? The course should be withdrawn there only. We should not use this estrogen and progesterone, the triphasic pill, and choose the alternative for that cycle only, and we can restart this preparation on the next cycle, 5th day of next cycle. Not much efficient than monophasic ones, so monophasic ones are the mostly used ones. The progestin only pill, it is also called as mini pill. Here in name we can find out that only progestins are used here. Eliminated estrogen due to side effects. Okay, taken continuously daily without any gap. In low efficacy, these are not much efficacious than a combined pill. Menstrual cycle irregular, ovulation occurs. Here it inhibits ovulation. Yes, in starting we have discussed, but here ovulation occurs, menstrual cycle irregular, and cervical mucus interference with implantation. These are the main actions of progestin only pill. It does not interfere with menstrual cycle or ovulation. It only interfere with cervical mucus and interference with implantation, contribute to the contraceptive action of mini pills. Okay, next we discuss about emergency or postcoital pill. After intercourse, like in emergency situations like rape or unwanted pregnancies, we should take emergency pills below some certain amount of time, like levonorgestrel taken in 2 doses 12 hours apart should be taken before 72 hours of intercourse. And other example is ulipristol, single dose we should take within 5 days. Mifepristone, single dose less than 72 hours, used for emergency. And the mechanism of action of oral contraceptives are, first we have to discuss about the normal process, what is going on in our body. We have our hypothalamus induces the pituitary to release gonadotropin releasing hormone. Then afterwards the gonadotropin releasing hormone will stimulate the FSH release and LH release. This FSH will act on ovaries and stimulate the estrogen release in that, and LH also it leads to LH surge, afterwards ovulation, afterwards progesterone is released in menstrual cycle. We know this process from 12th onwards. So if we are giving this estrogen and progesterone's combinations to avoid conception or fertilization. How does it happen? Normally estrogen and progesterone are helpful for pregnancy to occur, but here I am saying that estrogen and progesterone are used as contraceptives. How? If we given estrogen in excess and progesterone in excess, if it will inhibit FSH release and pituitary by feedback inhibition. This is also the same as estrogen. Progesterone in excess will inhibit the LH and LH release and pituitary also, so that the gonadotropin releasing hormone will not be secreted, so that FSH and LH levels will be decreased. So no follicles development. How these no follicles are not developed? See here. If FSH and LH are decreased, no, it inhibit LH surge, so that follicles fail to develop and rupture, so no ovulation. So if follicles are not developed, it does not happen ovulation. It is the primary mechanism of action to avoid conception. And the other mechanism of action by progestin only pill. The progestin only pill inhibit the LH surge but less consistently. The combined pill, here the combined pill will do more effectively. We are taking estrogen and progesterone combinedly to avoid these GnRH, no? So it is more efficacious. The progesterone only pill inhibit somewhat less consistently. So ovulation may occur irregularly, like 1/3 cycles. For 3 cycles, one time the ovulation will occur. In postcoital pill, when taken before ovulation, it inhibit ovulation by inhibiting LH surge. But if we take after ovulation also, it can still prevent pregnancy by direct actions on genital tract, like interfering with cervical mucus and implantation. Next, if if ovulation occurred and fertilization is also occurred, then it convert the zygote converted into blastocyst. Then we have to control, if we have to control the conception, then also we can use mini pills and postcoital pills, because the blastocyst fail to implant. These drugs makes the blastocyst fail to implant due to hyperproliferative or hypersecretory or atrophic endometrium. By making the endometrium hyperproliferative or hypersecretive, the blastocyst fails to implant. And also they make uterine and tubal contractions to avoid conception or implantation. And the action of mini pills and postcoital pills is mainly these two. Blastocyst fails to implant by this endometrium and uterine and tubal contractions. And the thick cervical mucus, this is the main action of progestin action. Sperms can't, if the cervical mucus is thick, the sperms can't penetrate through it and go to the ovary and fertilize it. So it is the first step inhibition. The progestin main action is to make the cervical mucus thick. In next video we will learn about adverse effects of oral contraceptives.